Hi everybody, this is Dr. N.S. Sampat Kumar, a professor in HOD, Department of Neurology, Narayanamedicalcollege, Nellore. My best wishes to everybody on this World Alzheimer's Day that is being conducted on every year on September 21st. In fact, September is being considered Alzheimer's month. This year, September 21st, 2020 Alzheimer's Day is being celebrated in view to decrease the stigma regarding the disease and to increase the awareness regarding what each individual should know about Alzheimer's disease. To say worldwide, 2 to 3% out of 10 people are not knowing much about Alzheimer's disease. The Alzheimer's disease, you all know, usually is not as common general public what they think is something related to the brain disease. But thing is that this is one of the most common neurodegenerative disorder you see in the elderly population. Elderly, for that matter, to say age individuals above 65 individuals. What to say about Alzheimer's disease? Alzheimer's disease is a disease actually which will really hamper your cognitive functions. To name the few of them is like they start have difficulties in memory. They have difficulty in speaking, like long ways functions also. They have difficulties in their planning and judgment also. So these are all fine functions every person has to carry out to lead a normal, a professional or normal routine activities in a day, irrespective of their fields. So Alzheimer's disease, I said, one of the common neurodegenerative disease, which classically affects the brain neuronal cells and neuronal cell connections, and the chemistry, the neural chemicals transmitters which mediates all these functions is being affected. So what to say it is special from other neurological disorders which you acquire like strokes, infections and epilepsy, so many other headaches and all diseases is a degenerative disease. That name implies that slow degeneration to the death of the neurons which are concerned for the higher mental functions of the body, especially cognitive, sometimes leads to behavioral mood changes also. To name some of them, there are so many dementias are there in the our routine clinical practice. We see the Alzheimer's is the most common one. So first of all, what is a dementia to say? Dementia is the one, the person, especially the elderly population, to say more precisely, above 65, there are few conditions, less than 65 people also get affected with dementia. Of course, there are different background, genetical, different background pathochemical changes are happening. But to say Alzheimer's, usually a disease of 65 years, for that matter, any dementia. So I said, there is a slow degeneration of nerve cells. You can ask me, with aging, every person, as he ages, not only the brain, all organs in the body, they decrease in the comprehensive organizational function. Similarly, the brain will also, with one organ, will go to degeneration. So the neuronal cells, they start degenerating, not only in size, their function also. When not only cell size is being, or cell function is being hampered, the neuronal other circuits and connections being circuits. The one common circuit you see is like a Papez circuit we say, which is most commonly concerned with your memory circuits. So when these cells, when these connections, we call some of the circuits with corresponding the chemicals, neurochemicals, we call neurotransmitters. So when these all get degenerated, that means decrease in size, both quantity wise and quality wise, then results in the degeneration. So when this degeneration happens to the individual, usually happens to every individual, but to the extent, disproportion to the age, if anything degeneration happens to the individual, that results in some of the pathological functions. So there is a physiology of degeneration. When this degeneration exceeds disproportion to the age, we call as a pathological process. This pathological process of neurodegeneration of the brain, which results in dementia. To the extent it will incapacitate to perform routine activities, you will depend upon family members or caregiving even for your daily activities. For example, a person with dementia may not be able to speak properly, may not be able to identify, may not be able to learn things, may not to take to self-activities also, and sometimes to the extent when severe bone disease, he may not aware of himself, what is being happening to him, what is going to happen to him, what is being happened to him, absolutely he is not aware of all these things. So this is a process where we call it as a dementia. So impairment of all bodily activities to the extent you become completely dependent on family members or caregivers because of complete degeneration of nerve cells. That is a dementia. The most common I said is Alzheimer's dementia. So why people are more concentrating on Alzheimer's dementia is means every year there is a changing theme of concept is being, but being September 21st, 2020, this year's theme is make of awareness of the disease. People have so many misconceptions, myth regarding the what the disease is, how it is being affects individuals, what best we should do to the patient to improve the quality, at least to delay the progression of the disease to the extent patient will be completely incapacitated. So I said Alzheimer's usually affects the higher cognitive functions like memory, the learning process, the long ways functions, and sometimes visuospatial functions all being impacted. So you ask me in routine activities, in simple terms, how do you quantify, how do you qualify, how you define all these symptoms means. So sometimes patients, first initial stages, sometimes patient may not come to you with symptoms that I am suffering with. Your family members, your professional working place colleagues, they will find something change in you. The decreased pace of work, some point, the decreased thinking in the process, and the communications how we make, there is a slight change they notice. So with this change in note of his behavior or his thinking, then we should have some vigilance over the what is really happening to them. So most of the times, the people who are routinely going to the routine activities, they go a little bit early, they go a little bit late, they don't have lack of time sense. Sometimes while doing work also, they may not able to concentrate. So they may not able to plan certain things. They may not able to judge what is going to be done. So what is being done. So these are way, when compared to the same age group peers or colleagues or same the activities which he did previously, there is a little drastic change will come into the picture of his how he perform his activities. So that's the first step. So second, the person with dementia, slowly, if he thinks that he may not that interested in surroundings, that he may not slowly communicate with their family members, so may not communicate with friends and relatives. The second is behavioral mood changes sometimes we'll see. Slowly he keeps himself very silent. Sometimes he becomes very vigilant. There's slight change in sleep cycle also. Most of the dementia patients, as their disease progresses, especially Alzheimer's and all, they try to wake up most of the times in the night. They try to go to sleep during day working activities. So there is a alteration of sleep-wake cycle. And they don't show much interest in food. And they did a lot of mistakes in their routine activities. For example, the people who works in banks previously and all, suppose person who is very good, independently going to do bank and do all his activities, going to some shop, purchasing something, shopping things and all, he may not do properly. That means some calculations, money calculations, they do a lot of mistakes by dealing with money, or sometimes they try to forget the person's names also, unless they get some clue they give to and all. Some over the period of time, they completely not able to identify the even close relatives to the extent. So these are all stages you go through. There is sometimes the stage where comes patient slight bit, he himself notices there is some change is happening to his thinking, change happening to his overview, then he realizes. Then as disease still goes, then we will come to know that he is not able to take care of his own bodily activities, and he is not properly aware of his body hygiene and his personality also sometimes, because not able to perform activities, they forget to do their activities, like routine activities which you used to do, like combing, brushing, clothing, all proper way of eating the food. All these activities he slowly forgets. So that really affects personal hygiene also. That is, he himself sometimes notices, and his family members, sometimes they'll come to you and tell to you. So this comes to a little bit stage there. So why I'm saying all these stages is that this is aware, we need to aware the public. So these are all the stages. If you try to intervene So this so and so person is being suffering with all these activities. If you bring those sort of patients to our memory clinics, we call, like, we being neurologists with so much of experience in dealing with all these memory clinics, this sort of patients, we will ascertain what are the factors really make him to become this disease. So it's not like an aging disease. That first concept, to just remove it. Not all aging individuals are not suffering with Alzheimer's disease. There are people with certain lifestyle activities, like some people very anxious, very stressful people. Obviously, with more stress you feel, the more stress you're being exposed, the aging process we call like oxidative damage, not only to the brain, the entire organs being happens, and that because aging changes will happen very early. That stage where if you intervene, we try to give the patient counseling and all, stress parts and all, if you take care, sometimes at least we can prevent the rapid onset of the Alzheimer's disease. Apart from this, few lifestyle changes and all, there are some good food habits. So there is well proven saying that there are some nutritious which nourishes the brain neuronal cells, especially the foods which rich in carotenoids, especially foods rich in B complexes, and foods rich in antioxidants. Definitely they'll take care of your oxidative damage to the neurons, and which will definitely prevent your aging and senility of your neuronal cells, and prevents the degeneration at a rapid rate. So if you intervene all these steps or early stage, definitely you can prevent. We cannot say there is a cure for the disease, in fact, to say, but definitely we can delay the progression, and we can prevent the complications and severe stages at very early age and all. And apart from this food and the lifestyle changes, there are some environmental changes also. The place you work, you always should be very hostile environment if you work that feels you to encourage you work to more hours, and happily you can live, and your quality makes a lot of difference to the disease progression also. And apart from this, there are a few risk factors. As in, to pertain to medical, we say the people who are diabetic with early age, there is a lot of studies says diabetics are very prone for Alzheimer's or sort of degeneration of neurons. It's common fact to say also, compared to the common persons, early diabetics or people with impaired blood sugars, they're more folds of risk of exposed to the Alzheimer's and all. At the same time, individuals with higher blood pressure levels like hypertensives, and people with increased homocysteine levels in the body, not only they are prone for neurodegeneration and dementia risk, they're prone for different increased risk of strokes also, the thrombotic events also. So all these factors, if you consider, any patient with early stage who comes, or patient with significant risk factors, we can at least prognosticate him, or you are at risk of developing this disease. If you take care of all these factors, I think you can at least prevent the disease to become full-blown dementia manifestations. So taking care of these risk factors also plays a role. So regular visits to the doctor, I think they'll try to counsel you what should be taken care of is mood changes and behavioral changes or food habits, and they try to give you the counsel not only to the patient, they try to give you the counsel to your family members and caregivers who are going to take care of you, because they go for a lot of mood changes. Sometimes they'll get aggression, sometimes they get withdrawn from the surroundings, they become very irritable. So at the time, the compassionate and very sympathetic talk to the patients and pacify them and give some positive hope to them and encourage to lead some normal routine life, say some few positive words, and those things really make a lot of difference to the day and out activities of dementia care. So this, after knowing the basic steps of dementia, because why I'm saying is, the steps you take it early, that will definitely prevent rapid progression of disease to the end stage. To say, there are a few things say, if you ask me, the dementia is direct response for death. Definitely dementia is nowhere is connected to the death, but indirectly I'm saying the fact, if patient comes with dementia that leads to death, never happens. Patients with dementia, if you identify the disease at early stages of disease, take proper medication and proper care and counseling, then take care of risk factors, definitely dementia can be, late stages can be prevented. Because in late stages, why I'm saying is, stressing the word, the late stages of the disease, the end stage of the dementias, patient will not in a position to know what is really happening to him. Patient not bothered about own himself, that he himself in a state that he is suffering with one disease. So such an extent, and he is completely dependent on for even routine activities, for bathing, for routine activities of living, like example brushing, clothing, will not able to perform. He is not in a conscious state to perform all these activities. So sometimes to the extent they will become completely incapacitated and they are bedbound also. So with this bedbound state, with not taking proper food, not lack of mobility, this will leads to a lot of risk factors will emerge, and sometimes will lead to a lot of infections that secondary leads to the death, but not dementia per se as a direct causal relation to the death per se. So you take care of all these features. So then you ask me, so how to identify? The first thing is you identify any change in their routine mental activities, which is compared to the normal public, normal colleagues or pair of same age, there is change, you notify something is mentally is not normal. Then try to put inquire into what are the other symptoms he is suffering with. Try to you counsel the patient and bring him to the memory clinic and identify the person, so and so person is suffering with the dementia. So at this time we can do some studies, risk factor evaluation like a diabetes, hypertension and homocysteines. There are other conditions like thyroid state, sometimes you have to rule out. Then sometimes you have to know calcium levels. Sometimes you need some infections you have to rule out. So after ruling after all these things, then we'll try to put patient into the imaging of the brain. They give the clue something like most probably CT and high resolution MRIs and some functional studies also, their PET scans we can do, what really a metabolic state of the functional metabolic status of the brain neurons will come to know. So what they give clue is, so this part of the brain or this part of the brain structure or part, lobe or area is being more affected when compared to the other rest of the brain compared to the normal aging. So by knowing those areas, by knowing those things, oh, they think this part of the brain is being affected, so this function is being suffering. So that gives clue which type of dementia you're dealing with. Sometimes any sort of tumor, sometimes something blood clots in the brain, if you found out by doing this process of imaging, you can treat those things also. So sometimes don't think dementia can be because of so many other reasons. If you properly address those reasons, dementia can be cured. But as aging related dementia per se cannot be cured. So for this only we can early diagnosis, and there are some treatments aspects you can go for. So by after knowing the things, after clinical examination, after knowing the blood test, after knowing the some imaging brain, you come to know this sort of dementia you're dealing with. So then comes your part of as a being a memory specialist, we call as a dementia specialist. What this advice is, there are few drugs depending upon your condition, considering the view of other comorbidities you're suffering with. There are few drugs, especially Alzheimer's you consider, there are drugs which will try to increase the neurotransmitter acetylcholine levels in the brain, like example like donepezil and galantamine, and sometimes drugs like rivastigmine. They take oral tablet form, so try to increase and titrate the dose depending upon your symptomatology and look at other drug interactions and side effect profile and all. There are new drugs like especially rivastigmine I used to say, there is a not only the tablet form, you have patch, which is yearly patient complaint is good, because sometimes at this age of 65 plus, 70 plus, with dementia, sometimes patients are not able to take the tablets on regular basis. Their compliance is not that good. So those people, definitely the patch is much helpful. So you can keep the patch somewhere in the body, the slowly drug will absorbed and therapeutic levels will be maintained, and the patient compliance of the drug also is being improved. So these drugs are not definitive treatment of choice, I say. They are the drugs will halt the rapid progression of the disease, but not complete cure of the disease. So ultimately the cure lies in the prevention. So you take up all these comprehensive overview of dementia, what are the incidents, what are the stages of the disease, when to identify, when bring the patient to the doctor, concerned memory clinics to take care of risk factors is much paramount importance as a comprehensive treatment of dementia. So the early identification and early institution of therapy sometimes require institutionalize the patient for counseling and institution of therapies and look for other risk factors will definitely improve the quality of life of the patient. So as a specific saying of the day, I want to say on September 21st, World Alzheimer's Day is, with this basic knowledge, I'm not overview, I can say, you should go to the public who are all really suffering with your family or friends or something else, tell the facts and remove their myths from their brain and encourage them to go for therapies so that you can really improve the quality of life. So my saying is that the day of my say is definitely World Alzheimer's Day, September 21st. My best wishes to all people, and my say is that remove the myths and keep more aware of dementia and dementia aspects, and what are the therapies available, what are the causes, and how to prevent the dementia. Suppose dementia comes, how to prevent the rapid progression by awareness and remove the stigma and better quality of life of the dementia patients. With this, I take my privilege to say all best wishes on this World Alzheimer's Day. Thank you.